Hi everyone, this is Dr. Raquel Butler from Integrated Veterinary Therapeutics.
And Sophie Vandenberg from Equine Postulate. And we welcome you to the Equine Functional Posture Podcast, your ultimate source for insights into the influence of functional posture on biomechanics, health, and overall well-being of horses.
Whether you're a seasoned equestrian, an equine professional, or simply a horse enthusiast, this podcast is designed to help you understand the critical aspects of functional posture.
Tune in each week as we discuss practical tips, delve into expert interviews, and explore the latest research in the impact of functional posture on equine anatomy, physiology, movement, and more.
Let's create a world where we empower our horses to be in a mental, emotional, and physical balance. Hi everyone, welcome to today's episode. We are discussing kissing spines, which a lot of people are quite familiar with the word kissing spine and probably has a fair bit of negative connotation, but it doesn't need to. So how are you going today, Soph?
Hey Raquel, I'm going good. Yes, you've done a webinar on this before, which a lot of people responded to, and there were a lot of questions about it. So it's good to talk about it again. It's a very common issue.
Yeah, and it really relates to posture. So that's a definite. So when we're talking about kissing spine, what are the other names for kissing spine?
So it's often referred to as overriding or impinging dorsal spinous processes, which are the top part of the spine bone. There's like a projection, a long piece of bone that comes up, and so that's when you run your hand along the horse's spine, that's the bit that you're touching the top of those dorsal spinous processes. And so when it says overriding or impinging, it's when the top bit starts to bump into the one next to it, and it's very common. 92% of racehorses and 68% of other horses have been shown to have it in studies. And there's a lot of mixed results about pain, sometimes not causing symptoms. So there's a lot of different presentations in lots of different horses who have it.
Yeah, it's very highly variable. And I guess that the most common area is at the base of the wither. So that's where we can, the wither is the spinous processes of those vertebrae, and then we can feel them going down the back, as Sophie said. And yeah, the most common area is kind of at the base of the wither, towards basically under the saddle. So T14 to T18, which is more towards the middle of the back. So anywhere from base of the wither to the middle of the back, and sometimes even the lumbar, we can get kissing spines in the lumbar as well. The thing is that just because they're touching on radiograph doesn't always correlate to the degree of pain, and I think that's a really important thing, is that your horse could radiographically have kissing spine or fusion, where the spines have actually started to join together, but it doesn't correlate to the degree of pain. And I think that's important for all pathology, that it doesn't always, just because the radiograph says one thing doesn't mean that because the horse has that degree of change, it has this much pain. I actually think the earlier signs of kissing spine are probably more painful because of the damage that's happening to the ligaments. And what we can't see on radiograph is the ligaments and the soft tissue surrounding the spine. And especially we can't see what's happening to the ligaments that sit like above and below the vertebral bodies. We'd have to do an MRI or a CT to get more detailed information, and that's really not easily available for horse owners at this stage. So the thing to recognize with the ligaments is that the fiber alignment, so there's lots of ligaments around the spine. That's what creates the stability. We have a lot of ligaments between the spinal processes, so those dorsal spines. We have a lot of ligaments between the vertebral bodies that keep, really kind of support that spinal structure. And so when the spine is overloaded, or which could be from riding, or it could be from poor posture, those ligaments don't like to be pushed out of their boundaries. And so when they're pushed out of their boundaries, then they start to get cranky, changes at their attachment points, they lose fiber alignment, and then we get an increase in pain fibers, an increase in like other kind of sensory nerve fibers, and then they can become like fibrous as well. So they actually lose integrity that pulls on the bone. And so you're getting like a pull on the periosteum, the outer covering of the bone, which is very sensitive. And so that's, it's more that ligament stuff, which is going to cause pain.
Yeah.
And then when it progresses to the alterations in the bone, what kind of things do we see that can happen in the actual bone? Which I think the ligaments are a precursor. Ligament changes are a precursor to what happens to the bone.
Inside the bone. So number one that you might see if you look at a radiograph result would be the change in shape of the vertebra themselves. So they often will lay down bone, and you'll see as they when it's a little bit more progressed and they've gone from starting to touch and pushing into each other, you'll see that often they will kind of like the bone will change shape as they merge into each other. So I have a skeleton at home where one bone in front quite literally has like a big U shape in the back of one of the bones, and the one in front of it has developed, like a curve that pushes into that shape. And so they're not fully fused now that the ligaments have deteriorated as the skeleton is just bone, but they were incredibly close stuck together, and the ligament itself was incredibly fibrous. So you can have, like you said, the periosteal reaction, like you were talking about, and when the periosteum is strongly influenced, and you can also get cysts as well. And you can have fusion between the bones, depending on the two bones next to each other.
Yeah, and I think what you said there about the bones changing shape relative to each other is to recognize that bones are changeable tissues, and they change in response to the way that they're loaded. And the way that they're loaded, we can think of the loading being like physical loading, like sitting on them, saddle pressure, rider pressure, that sort of thing's going to influence the way those bones are loaded, but also loading in terms of like pull. So, how they're being posturally loaded, in terms of, when the body is in motion itself. And so the bone shape will change in response to that loading, which also means it has the potential to change back, if we can set up an optimal environment, and depending on the age, because as a horse ages, the bone turnover decreases. So we have more ability to influence bone shape and structure the younger the horse is. But bone is not unchangeable. It just takes longer than other tissues. So, if your horse has the beginning of kissing spine, there's really good chance that you can reverse that through appropriate exercises and awareness. The other thing, just before we move on to why it occurs, is that when you've got that the changes in the ligaments and the increase in the pain fibers and things, is that horses can then present with neuropathic pain. And I don't know if anyone's had nerve pain. I have. It's unpredictable. You can be going along and then it's like someone just stabbed you. And so these horses where, they're going along fine and then they do some sort of shooting movement, like they might just shoot forward, or they might all of a sudden out of nowhere, start bucking or rearing, or doing some, like I saw a video yesterday, like doing some weird head movements or some behavior that seems to come out of nowhere. I would say it's often neuropathic pain, and I think horses get that much more commonly than we recognize, because it's difficult for us to measure, and it's variable, so highly variable.
Yes, and I think that is just a good point, that there's next to no unexplainable behaviours in horses, and that things aren't, explosive behaviours generally have meaning. There's meaning
Yeah.
behind them in that case. Yeah.
Yeah. Yeah.
So if we go on to why does it occur, what's the screaming big number one underlying sort of systemic issue for a horse?
Functional posture.
Yeah. Well, not poor, but those spinal stabilizers and core muscles are the foundation of having a healthy spine, because movement through the core and using your spinal stabilizers offers integrity to the strength and the shape and the alignment of your spine.
Yeah, and I mean, this can be set up in a young horse, like if you have a horse in the paddock that's growing with a bit, already showing some signs of maybe a little bit of a sway back or a weak back or a poor core. So like even Ellie, she's actually improved over the last little bit, but like when I would ask her to trot her, I would describe her as having a poor core because she had a downward swinging back. And if I then started her, like really started her with that posture, so like she started to be ridden in a saddle that maybe wasn't well fitted, and then maybe a rider on her who was bigger, then I'd be setting her up for kissing spine because she already had poor core strength, not optimal posture, and then I'm loading her. And I could feel that, like I've sat on her a couple of times, and I can feel that still she doesn't have the. Now, obviously, when you first sit on a horse, there is going to be a bit of a dip, like they're taking weight for the first time. But, her back does not know how to support weight at the moment. And so if she was then loaded up for 6 weeks at the breakers, that's a great way to predispose them to kissing spine, especially if they haven't done any work to improve their postural, like what you were saying, improve their postural stability, their core strength, their balance, their all of that. They don't have a saddle that fits them. It's like a great start for kissing spine.
That's it. And I suppose other things that have come up, there's a few studies about how when you begin to activate your spinal stabilizers, it's fantastic for back pain, and you can get an increase in the size of your core muscles, and that's well studied. But in the opposite direction, it happens too. Once you put them in a position where even if they have a back that's functioning okay for what they're doing in a low level of work as a young horse, jumping around the paddock with their friends, usually very mobile, and then you put them in a situation where you don't ask them to use those muscles appropriately to develop them over time. Once you take the step towards, they go into a bit of a regression for the situation, you then are coming back from that. So it's always better to set them up from the beginning. It's not that it's, you can't bring them back from that, but it's always wonderful to start on a good foot.
Yeah, and to understand the aspects that set you up for that, like going back to, some of our previous episodes, like being able to recognize core strength, being able to develop core strength, being able to recognize like iliopsoas issues and then know how to develop strength in that. Like those two areas, thoracic sling, like we've done episodes on the thoracic sling, like especially those three areas are key for preventing kissing spine. If you can recognize that dysfunction early, then it really empowers you to be able to do something about it. And you are the person to do something about it, not the vet, not the body worker, not yeah, like it's you can do something about it. You can like have a big influence on that. So when we've obviously saddle fit, rider, um, hoof balance, dental balance, like they're all really important, and we're going to go into prevention. But I think we should just jump through to the signs that people might notice if their horse is starting to perhaps show, you know, some kissing spine. So what kind of things might we see
So
in horses?
a very obvious one is just going to be sensitivity along the back. So that might be back pain when you run your hand along there. You might get some skin twitching, tenderness. Often you get a lot of tail swishing, I find, for the back. And often, the head might come up or they turn around to nip at you. You can see sensitivity, and you can generally see it in the tissue there too. And their
Yeah, and
behavior.
often it doesn't easily go away,
Yes,
So like you could have bodywork sessions, but it's just not really going away. That's when it starts to raise alarm bells for me. Like when I've treated a horse a couple of times, but the same area keeps coming back. That's when I'm like, there's got to be some underlying pathology here because I can't seem to get this to a point where it's A, pain-free, but B, functional. So, if I can't get good belly lift, for example, or good ability to lift their thoracic sling, then I'm starting to question why can't I get that? And why does this pain and reactivity keep coming back?
definitely. Another symptom can be changes in top line. So that might be one that your horse has begun to lose top line, or you can also have a difficulty in developing it in the first place. So what you'd be looking for is a evidence that maybe your horse has a deep wither pocket, and then beside the spine coming to the rib cage on the side, that there's it's quite hollow. Maybe the skin and the tissue is quite dry, and often it doesn't have a very nice texture. It's either very hard, overly soft, but changes in top line is a really big symptom, and that often spans all the way along the lumbar as well.
Yeah. And then they can also be reactive to when you put their saddle on and when you girth them. And again, it's something that doesn't sort out easily. Um, like you can get horses that are girthy, you release the restriction in the thoracic spine, and then within one session they're fine. So it's the ones that kind of keep coming back, or they're always kind of drop in the back when you put the saddle put the saddle on, which could be a saddle fit issue, or a primary horse issue, or they're, cold backed. I don't think that we should be accepting, oh, he's just a bit cold backed. Well, that's not an answer because if he's just a bit cold backed, there's a reason for that, and you need to understand and fix the reason. Otherwise, you're just setting up for dysfunction and pain and pathology going on from there. I think a big one too is the choppy movement, especially in the front legs. Like they can look like they've got sore feet, but it's not always the feet. And that's that fascial connection, from the spine into the feet. What else would you say?
I would say people often see that their horse is having difficulty with transitions, especially in the canter and in corners when you're asking them to bend, and usually have that bit of bend through the thoracic sling if they're going around on a bend. And so that's often a time that you begin to get some behaviours, or they'll really adjust their movement, like they'll swing their hind end out to stay straight, or they'll only bend through their neck and not their body. You often also have a lot of avoidance behaviors. So horses will not want to approach the tie-ups mounting area. They'll rear, buck. A very common one is reluctance to go forward. I would say that's something I'd hear a lot. And also they often have this head up, dropped back movement that's either that sometimes they do that with the saddle on, or when you start to ride, or it becomes standard for them, even when they're just resting in the paddock or moving around with their friends. So those things really scream avoidance behaviors, and they're something that people can look out for in their horses always. You just monitor it as a lifelong thing. And if you recognize that they are often physical issues primarily, then you can search for solutions.
Yeah, And sometimes it's just very vague, like the horse is just not performing well, or they just don't have the suspension that they used to have. So they don't yeah, they just don't feel like they're moving as well as they could, and they're striding out and able to lift up through their back and carry themselves as well as they could. So, yeah, these are some of the considerations. Now, if your horse is, moving away from back pain and creating a posture because it's uncomfortable, then there's often concurrent issues related to that. So, if you're going around in poor posture, other bits of your body are going to get sore. So, you can have people who have back pain and they end up having knee pain, but it's coming from their back, for example, or, they've got pain in some other part of their body, like their neck, but the neck is not the primary, it's in the pelvis, something like that. So, that happens with horses too. So if they're constantly walking around with a sore back, it's going to affect their hoof balance. So hoof balance and it goes hand in hand. It's like one will affect the other and the other will affect it. So the back will affect the hooves and the hooves will affect the back, unfortunately. Um, It'll also put a lot of strain through the sacropelvic area. So if you imagine hollowing out your back and then feeling the strain that that puts into your pelvis, and then if you've got to engage your pelvis and your core, try doing that with like sitting there and dipping through your back, and then think about how you're going to engage your core. What you're going to have to do is probably put more strain, yeah, it's hard, put more strain through your hocks because they now can't push underneath you. Like they're now pushing out the back because you're in this inverted posture. So you're going to get hock arthritis, put strain through your stifles, soft tissues of your stifles. It puts strain through your suspensory ligaments because you're not pushing in a good place. And then if you also imagine it, think about what's happening at the base of your neck there. You can't lift through your neck if you've got a sore back. So you're predisposing to neck arthritis. And then we have this whole body like dysfunction going on, which, yeah, you can get the back comfortable, but you've still got to rehab that posture and get everything comfortable again. And I think this is where a lot of horses end up having their hocks injected, but the problem wasn't in their hocks, it was like their spinal stabilizers, and they're not able to use their core for whatever reason properly. And so the hocks are copying it, maybe from back pain, maybe, I mean, you can get back pain from sore hocks too, but I really believe hock problems are a product of poor posture, and inappropriate loading.
A funny example for that, well, not so funny, but my own horse that passed last year, he always had this very exaggerated hock motion. And people would say, wow, he has beautiful hock flexion. Like, look how he moves his hocks. And I don't think his back looked as stiff as it should have because I was always doing a lot of work. Um, a lot of mobilizations and stretches, a lot of hand walking, etc., and less riding too than a lot of horses might get. And when he passed last year, after seeing his skeleton, he has very extensive, he was an ex-race horse, very, very extensive kissing spine.
Yeah, right.
And it's very interesting. He also had foot tenderness that was, he's honestly the poster child for it. And all of the work that we did, which is all the EFP coursework, etc., all of that kept him moving well enough. But I never did a full, kissing spines rehab really for him. And he had a couple of very serious injuries to his pelvis earlier on. But all of these signs and the hock motion that he used to use rather than his back, engaging and
Yeah,
coming through.
somewhere else has to move when somewhere is not moving as well as it could.
Yes, to make up for that. And so, that's something that really pops up. And just when you were describing, arch your back and see how it happens. I just thought to myself, I've interestingly immediately gone, I'm sitting on a chair, my feet went into tippy toes, my calves became very tight, and then my knees bent, and I've done that so that I can sort of ducktail my pelvis and dip down. And I immediately tipped and I went, oh. And then my left ankle, which I tore the ligaments in once, had a mini twinge. And it was just the carry on
effects of all of
body.
that.
Yeah. And
Yeah, and they often have tight hamstrings because of the change in the pelvic angle and yeah.
Yeah.
And I think what you said about him, the foot, the hoof discomfort, maybe the horses that can't tolerate being out of shoes, we really have to consider their spinal health massively. Because the more, I have that awareness, like of spinal function and foot pain, like I see the horses that are really struggling with foot pain are the ones that don't have the healthy spinal posture. And you could say, oh, well, they've got foot pain, that's going to have a negative effect on their spinal posture. But I think we have to consider it going the other way as well. That if they've already got kissing spine or pathological changes in their spine, the way that influences their fascia and the pull going to those feet is going to set them up for foot pain too.
Yeah, definitely.
So yeah, it's hand in hand. So when we're diagnosing it, so we talked about x-rays. Probably the biggest thing I'd say about x-rays is don't treat the x-ray. You need to look at the horse that's in front of you and treat the horse. So just because they've got terrible x-rays does not mean that they have terrible function, or just because their x-rays are not showing kissing spine does not mean that they don't have ligament pain and dysfunction, because we cannot diagnose that on an x-ray. So if you're also struggling with things like belly lifts and thoracic sling work and using their posture in optimal ways, well then you kind of managing them the same way as a kissing spine horse. Like you're building the same things, like core strength and psoas function and thoracic sling function and spinal health. So that kind of brings us into, if you think your horse has kissing spine or you've got a diagnosis, well, what can you do?
There are lots of options because it's not a death sentence at all to have a horse with kissing spines.
And it doesn't mean that you'll never be able to ride them again, but it means you're responsible for getting them to a healthy state for ridden work.
Definitely. And yeah, so there's lots and lots of things you can do. Firstly, straight off the bat, if you're listening to this and you're like, oh gosh, I think my horse has it, go back to our episodes on core strength. There's 2 of them, recognizing core strength and then developing it, and also an episode on proprioception. And have a listen to those, and then you'll get some context exactly how the core functions, and further evaluating your horse a little bit for their development through there. Your other things to really focus on are going to be your hoof balance. Feet are really important, and having a good place to land while your horse is moving around is very important for them, like we talked about the hoof to back connection. Reducing inflammation to decrease sensitivity and pain as much as you can. So that's having a diet that has really good quality nutrients in it, making sure you're providing the right amino acids. You can also use McDowell's Alleviate, which is a herbal tonic from McDowell's Herbals. You can use gabapentin. The most really, really important one is going to be appropriate movement. So that's something we definitely teach in the EFP level 1 course, particularly, through the spine mobilizations. But you can inhibit a lot of stiffness and some pain through really good quality movement. What about other options? It's been
Yeah,
tested.
laser can be really beneficial. So I've treated a few kissing spine horses with laser and taping. Um, and I've actually, often leave the owners with a taping method that works for their horse. Often the horse will dictate which ones they prefer, which ones give them the most relief. So that can be really beneficial. NMES is neuromuscular electrical stimulation. And so that can be really beneficial for stimulating the muscles around the spine to start working. And you can, get those little machines quite cheap and learn how to use them on your horse. Obviously, regular body work, chiro, osteopathy to ensure that you've, like you said, got appropriate function. And then the other ones that are really beneficial, prolotherapy. So we might do an episode on prolotherapy at some point because, yeah, I've used that a fair bit with kind of chronic spinal issues and had good success with it, but there's not many vets who offer it. So, there's a few of us, ABM vets, who offer it. So it's a dextrose solution that reduces inflammation and stimulates healing growth factors in the surrounding tissue, reduces like the sensory nerve irritation that's occurring. And so, they've used it a lot in humans in disc problems and had like 100% success. So it's really successful for these types of cases. Other modalities could be shockwave, working with a vet with regular shockwave, or PEMF, but PEMF has to be used on a regular basis. It's not a one-off treatment. It needs, it's probably better when the owner buys a rug like a Beamer rug and is actually doing it themselves. I think PEMF is the most valuable when used like that, at a low frequency, a safe frequency. But the most important thing is that, a lot of these things are reducing the pain, like laser, shockwave, prolo, PMF, osteo. But really, the most important part of that is, like you said, function and the rehab exercises, which through the equine functional posture course, we've had a lot of people in that course who've had horses with kissing spine.
Yeah.
And they've already had rehab plans, some from their vets, some from, different places. But what the course has done for them has empowered them to, like, A, recognize where their horse is at posturally, B, give them exercises and how to implement those exercises in a very specific,
Tailored kind of way for their horse. Yeah.
yeah,
Yeah. And this just is like, it's almost when you don't have an understanding of the underlying concept of why or the aim behind an exercise, and you don't know where your horse is at, it's very hard to tell, is this having a positive improvement? Because what does
yeah,
it look like to improve? And also, is this exercise the right, is the way that I'm doing this exercise, one, the right way that my horse needs? Is it the right exercise for them at the stage that they're at? And other things, sometimes your horse needs support somewhere else,
yeah,
right, in their body to support another area that's struggling. And if you don't know the underlying concepts of functional posture, it's very difficult. And just for context, function means, can your horse use these structures or access this kind of movement right now? And if they can't, how are they carrying out the movement that you're asking them to do? Because it's unlikely to be targeting the tissue that you really want if they can't function through that space. So you have to use some other techniques to bring in function, whether it's an activation, a mobilization, etc., to bring function, to use it.
yeah. And we have had people, and I've had people in my clinics too, who are quite progressed through their kissing spine rehab. But when I've asked the horses to do very simple exercises that, require a specific use of their postural muscles, they haven't been able to do it. And so that's where you want to make sure you could be doing the exercises that are recommended for a rehab plan, like what you said, but the horse is not engaging the core or not switching on those spinal stabilizers or yeah, just not as aware as you think of their legs and their body. And so the benefits are just not as much as they could be. And when you're doing exercises that are very beneficial for the horse and very specific, you will see an improvement each time you do the exercises. Like, I think that blows me away every time that the more I break it down and the more, aware I am of how I'm doing an exercise, even in my own body,
Mhm.
then the next time there's always an improvement. And if you're not getting an improvement, then you've got to ask what's the missing piece here? Like, is it the way the movement is being executed? Is it that the right muscles aren't switching on? Is it that I don't have relaxation and there's some brace in there? Is it pain? Is it emotional? Whatever. Like, there's lots of different components, and I think that's what we give in the course is that personalized feedback so we can try to figure it out for your horse. Even if all the horses had the same structure, like the same rehab plan structure, they'd all be probably executing each aspect of that in a different way, and there'd be a different focus for each individual horse, even if they're doing these same exercises. And I think for any rehab program, that's really important. You can have the perfect program, but it might not be, there might be a different execution for each individual pair.
Definitely. That's it. It's very important to remember horses just are as individual as people. Like, that's why you can't buy a one size fits all program. And it's also why often people, so for this course, sometimes we say one of the biggest skills you learn is your observation. And that sometimes doesn't sound very exciting because in the moment it doesn't feel like a practical skill that brings meaning. Like, you want to be out trotting and doing the exercise or the stretches, and it feels like observation isn't as useful. But the observation is what gives you all of the context and all of the power to adapt what you're doing with your horse at the time. That we give a lot of skills as well, but the observation, people, when we end a course and you say to people, what's the biggest change? It's what they see, how they see it, and how they can shape and change things for their horse. One example that I just see nearly every day is often at the end of a bodywork session for me, if I'm demonstrating stretches for somebody, I could do the same stretch for 3 different horses on a day, almost as an assessment as well to see if they could use that. And they all need it just a little bit differently.
Yeah.
A stretch out in front, one horse, you'll be able to say, we still aren't getting opening through the belly and spine. Like, we have to do a little bit more here, or you do it for a few days and see if it changes. And the next horse that I see can do it, but you have to hold the carrot lower because he doesn't have the ability right now because his lower neck is tight to reach up and forward. So, if your observation and having a supportive network of knowledgeable people is unparalleled.
Yeah, definitely. So, I guess in terms like that's a lot about prevention there is those skills. Um, I also would just add in terms of prevention is like in-hand work and mindfulness in riding and in-hand. Um, because riding is definitely not a way to rehab a kissing spine horse. There are some amazing riders out there who, in their hands, I probably know two, maybe, no, maybe four, who could ride in a mindful enough way to help a horse with kissing spine. But they have to be very balanced, very aware, very understanding of like signs of fatigue and very able to work with an individual horse and really in control of their own body. Like, their own balance, their own awareness, all their own tension, all of that. I think a big part of rehabbing kissing spine is the way that we work with them in hand. So like you were talking about, other exercises like mobilizations um and things like that. So that's all great prevention. Equibands, fabulous, has to be applied at the right time. But the more we can do in hand, so the best way to build top line is in hand and getting the horse to use its body in a correct way in hand. And we've done a podcast on that as well, and the value of in hand work. And so to prevent your horse from having problems with kissing spine, you want to have good core use and development pre-riding. You want to know that you've got a good functional thoracic sling, so going back to those episodes, and that they're able to use that core comfortably, and hold themselves in that posture. And those horses are effortless to ride, so they're not going to get kissing spine. They're holding themselves, they're comfortable, they're relaxed, they're not creating brace, and you can just literally sit there and do the most amazing things. So thinking about that in prevention. Anything else you want to add with prevention?
No, I don't think so. I think we've sort of got over it. I do think that your management is a big consideration, though. How is your, there are lots of, one, I think the episode we have on variable feeding positions is very useful for prevention because it's fantastic for your spinal muscles and your core, activating the core, just that,
Yeah, and the other one is the activations, mobilizations, and lengthenings. That's a good
Yes.
episode too. The other thing I would like to add is just tack fit. So yes, saddle fit's integral, girth fit is integral, but even bit fit is going to change the way that your horse uses its spine. And bridle fit can change the way your horse is using its spine. So whatever tack you're using on your horse, know that it's comfortable and how it affects their biomechanics. And whether it's, changing their biomechanics in an optimal way. So understanding that. Yeah.
Awesome. So I would say, as a takeaway, core strength, very, very important. Lots of function before, coming up the levels of coming back into, more work or riding again. But being confident that a kissing spines diagnosis isn't a death sentence and you have lots of options available to you and lots of information about bringing comfort back to your horse, whatever their bones end up looking like in the future. There's a lot of improvement to be had for, every horse.
Yeah, definitely. And empower yourself with, the skills and the knowledge to help your horse and know, your observation skills in terms of recognizing a functional and dysfunctional posture and how you can actually help it. Keep variation in your training as well and make it fun for your horse. I think kissing spine rehab can be pretty arduous on the horse mentally, and so making some fun in there. And I think that's probably my biggest takeaway with the kissing spine horses that I've worked with. They have pain and dysfunction, and they're often a bit more sensitive because they've experienced unpredictable pain, you know. And one of them, he was a 5-year-old stock horse and he had thoracic sling damage. I believe that he actually damaged his serratus under his scapula and then it ended up with kissing spine. And we couldn't do the rehab with him. He was really difficult. He was rearing. He was actually becoming dangerous for the owner to handle. And yeah, I was kind of like, okay, I don't know. You know, we tried a few training things, but then he'd do something else. He'd, instead of rearing, he'd kick out at her. And so he hated feeling unstable. And so in the end, she took everything off him. And I went back there one time. I said, "Oh, how's he going?" She's like, Amazing. He's going so good." And I said, "Oh, what did you do?" She's like, "I'm doing it all at Liberty." And so she just had treats and she did all the exercises like that we were doing, but she did them all in a really fun way. So he didn't realize that he was doing work. And because he was a really smart stock horse, so he was like, "Oh, this is so boring. We're just walking across here and it's not comfortable and I feel unstable." So as soon as we made it fun for him, he was like, "What do you want me to do?" And like he's from that point on, his body just improved out of sight. Like it just and then for the movement aspect, she'd take him out, walk him through the bush. So
Yeah.
he was like busy stepping over sticks, and so his proprioception was being trained and he was looking around, and uh it was a long rehab process for him, but when she moved away, but when he left, I was like, I think he could consider to start riding him now. So you've got to make it fun, and we had that in our equine functional posture course as well with some of our kissing spine horses, that they were really getting shitty with the work. And again, we made it fun. We, in the arena, made little games for them, put little treats around so they were holding themselves in postures that we wanted, but they didn't know that they were doing rehab. They just thought, "Oh, this is a fun game. I get to go exploring around the arena," and they trot over to the obstacles, and their posture is so much better when we can create it in play. And so if you're rehabbing for kissing spine, you need to find some fun in it to help your horse. Like they will heal so much quicker if you can find some fun and some play in that.
Yeah, that's really nice.
And the other thing to recognize, we didn't really talk about surgery, so perhaps we'll do another one talking a bit more about that. But um, in my opinion, surgery is a very, very last resort option. It often makes them better because you're cutting nerves, and so they don't feel it anymore. Whether that's appropriate or not, that's all up for discussion. Regardless of whether you have surgery or not, rehab is the key. And, there's been studies to show that 82% of vets reported improvement of clinical signs with rehab alone, um, without the surgery. And that often when rehab was started pre-surgery, there was a significant improvement. And in that paper, it also was like said the first line of treatment should always be non-invasive. Rehab, chiropractic, osteopathy, physical therapy, prolotherapy, acupuncture is another one we didn't mention. You know, uh, when you do those things, you can get just as much an improvement as surgery, but you haven't cut anything. So you've still got full structure in there. And so don't ever think that surgery is going to fix all of your problems, because it won't. And when you do surgery, you need to be rehabbing from day one post-surgery. And I think we leave it too long post-surgery. 2 or 3 weeks is way too long. Overseas, they're rehabbing them starting day one after surgery. They've got a rehab person in there doing stuff with the horse. So I can't reiterate that enough.
Definitely.
Anything to add to that?
I don't think so. We've covered it. If we end up doing another episode, then yeah, more in the, what you can do once you have, um, found out you have kissing spines. But for now, I think that's quite a lot of info, and I hope it was useful for anybody who's listening. Whether you know someone with kissing spines, you think your horse has it, or you want to make sure that you don't fall victim to possibly developing it through postural issues.
Yeah, and we'd really love to see you in our next equine functional posture course to help you prevent it or to help you manage it. So Thank you for joining myself, Dr. Raquel Butler and Sophie Vanderberg in today's podcast. Enjoy your horse time. Please subscribe to the Equine Functional Posture podcast so you don't miss our weekly episodes, and give us a 5-star rating so we can share more valuable insights.
And we'll see you in the next exciting episode.